Okay, so I've been having the same conversation with a lot of my ICU patients' family members lately, and I thought it'd be good to kind of share on here because I'm sure there's a lot of people that have had or have a loved one in the hospital right now, and this might be helpful for you guys. So a lot of ICU patients' family members have a hard time comprehending how their loved one can go from being like functional on their own, walking around, to now in the hospital, like having to make these decisions about like life or death. And so I kind of want to walk you through this and give you an example. So let's talk about Grandpa Joe. This is just a theoretical story, not something that like actually happened, although this could pretty much be almost every patient I've taken care of. Grandpa Joe, 70 years old, lives at home with his wife. They like to garden together, live on their own. One day, Grandpa Joe is gardening and he, is digging up his flowers, stands up, he's a little dehydrated, gets lightheaded, falls forward, hits his head on the brick wall that's along their house. His wife calls 911 because he has this big gash in his head, and 911 gets there and figures out that he's got high blood pressure as a history. He's a diabetic. He has some cardiac stents, so he's on blood thinners. So like, hey, we need to take you to the ER, get a scan of your head. Takes him to the ER, gets a scan of his head, finds out he has some bleeds. So the doctor says, hey, we're going to admit you to the ICU because we got to do frequent neuro checks because you have these bleeds in your head and you are on blood thinners. So gets to the ICU, doing generally okay for about 12, 24 hours or so, and then his neural status starts to decline. They get another scan of his head, the bleeds are increasing, he has more swelling in his head, and Grandpa Joe is just getting very, very, very lethargic, so much to the point where they are going to put a breathing tube in to help protect his airway. So then he gets a breathing tube in. He has this in for a while. They discovered that he got a pneumonia, probably from aspirating some of those secretions and things in his mouth when his neural status was so poor. Those were going down to his lungs, got infected, now he has pneumonia. They can't get him off the ventilator, and so at about the 2-week mark, the doctor says, hey, let's put in a trach. We'll put the ventilator from your mouth down to your neck, and we're going to put in a feeding tube. His wife says, okay, let's do that, so that way he can try and get stronger. He gets that done. Well, Grandpa Joe's neurostatus still pretty poor. He's kind of got some delirium. He's really restless. He's not really responding meaningfully, but he's like agitated and delirious, so he ends up pulling his feeding tube. The feeding tube gets dislodged just enough, but no one was quite aware of it because it was just internal. Now he has tube feeds. All those feedings are going into his abdomen and are starting to get infected. So over a couple of days, his abdomen's getting distended. He's really uncomfortable. His white blood cells are going up. His lactic acid is going up. All these things that show that he has an infection. They do a scan of his abdomen, find out that he's got a bunch of infection and tube feeds in his belly.